How do you feel about the healthcare policies in Singapore? Is it effective?
It's not too bad. Not too bad. I think the government is coming up with more for the poorer people. So I think they are looking into how they can care for the lower income groups better. I think it's not too bad. It is improving.
What would you like to change about the policy?
What I like to change about the policies? Perhaps allowing the GPs to have access to the kinds of medications that the polyclinics have at that kind of price, which we will not get.
What are some of the problems faced by the government when implementing these policies?
What are
some of the problems faced by the government when implementing these policies?
I suppose the re-education of the public. They have to teach the public what are these new policies, how to go about using them, how to introduce them into the polyclinic system, and how to encourage the patients to move out from the polyclinic to the GP setting, and to reassure them that the prices remain cheap and affordable for the patient. I think all these take quite a bit of time, quite a bit of financial resources, and of course they also have to share these policies and how to go about implementing these policies to the GPs as well. So that would take quite a bit of time and financial resources as well. So it's education of the patient and education of the doctors.
Okay, then.
That's it? Okay?
Thank you.
Okay.
How do you feel about the healthcare policies in Singapore? Is it effective?
It is not very effective as it is expensive and not everyone can afford it.
What would you like to change about the policies?
I hope that the government will decrease the price of medical treatment so that people can afford the medical fees.
What are some of the problems faced by the government when implementing these policies?
They face problems such as getting people to get used to these policies and adapt to them.
Okay, thank you.
How do you feel about the health policies in Singapore?
The health policy in Singapore is quite adequate for most of us.
Do you find it effective?
Yes, in some disease, like more serious disease,
What kind of disease?
cancer, diabetes.
And what are some of the problems faced by the government when implementing these policies?
The price, the cost of the medication, the duration of the medication or hospitalization, the cost of the operation. Yeah.
What would you like to change about the policies?
The price, make it slightly more cheaper.
That's all?
Yeah.
Okay, thank you.
How do you feel about the health policy in Singapore? Is it effective?
Not very effective because most of the elderly cannot afford the medical services because they have no money to buy medicine. Because they will die early.
What would you like to change about the policies?
I hope they can reduce the price so that most of the elderly can afford it.
Okay, there's no more question.
Okay.
Okay, bye-bye.
Bye-bye.
The policies are not very effective because the price is very high.
As can be seen from the interviews.
Yeah. We have also learned teamwork and cooperation and how to work together as a team.
the limited time given by the teacher.
Yeah, there's not enough time. Yeah,
We had some problems such as
but I'm so busy.
getting people to let us interview them as they are very shy and some cannot speak English.
Yeah, language barriers.
Basically, this project is successful. Although there are some,
I find that teamwork is very important for a group project to be carried out successfully.
I feel that this project is very helpful, which it helps us to know more about the healthcare policies.
We have gained a lot of knowledge from this project.
and we hope that there are more projects like this in the future.
Thank you. How do you feel about the policies in Singapore? Sorry, forget the health.
Okay, now elderly cannot afford.
还没有 start 啊？
Start 了啊。
哎，你 stop。